Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
I'm Dr. Nammon, right? Orthopedist and hip and knee specialist, all right, arthroplasty, changing the joint specialist, right? Today, I will talk about the hip and knee pain, all right? Anyone in this room has the problem before, right? About the hip and knee, yep, right. So today that I will talk is like about hip and knee pain that originate or caused from the degeneration, degenerative, right? Yep, this is the thing that we will talk today, right? Okay, we go on. So coxatosis, this is like the terminologies of the osteoarthritis of the hip joint, right? We divide that into two cause of that, all right? From the hip arthritis. Firstly, that's come from the primitive or primary coxatosis, right? Normally, if you have like the hip anatomy is like the normal hip, the develop of the primary coxatosis is gonna takes time, right? It should take after about 60 years old or more than that, right? It depends on the age, okay? And the group of the primary coxatosis is like about 40 cases of the all case, right? The second coxatosis is like the degeneration that's come from the hip dysplasia or anatomical deformities, all right? This is take like the short period or to develop about the arthrosis condition. You will see it's like the younger patient who face with the problem of the secondary coxatosis, and more than 50% of the cases, this is like the group of secondary coxatosis. Okay, this is like the normal hip joint, and this is like the has the problem of the degeneration. You'll see it lovely in here, right? For the diagnosis, based on the symptoms and for the physical examination, right? Luckily for the symptoms of the both primary and secondary arthrosis, coxatosis is like the same, all right? We face with the pain, all right? It's the hip pain. I will talk about the hip pain. The joint pain is composed of the two mechanisms of that. Firstly, that's come from the mechanical pain. If you have the abnormal of the structure of the hip or knee joint, when you move, when it's like you loading the load to the joint, it's like the mechanical problem, right? So you will have pain from the mechanical things. And when you have like the mechanical problem, it will produce about the secondary things that come from inflammatory process that I call like the chemical pain, right? That you will getting better by the medication. But for the mechanical pain, you cannot take the medication and it can cope with that because of it wrong with the mechanical, all right? This is the difference between the mechanical pain and chemical pain, right? So for the coxatosis or like the degeneration of the hip or joint, anything, yep, it create about the mechanical pain, right? So the pain typically that's come from the hip joint refer to the groin, right? Refer to the buttock, refer to the knee and thigh, but not longer below the knee. This is the typical pain from the hip joint, all right? The stiffness, this is like another symptom that you will see that in the arthrosis condition, right? You will feel like, like the discomfort or limping when you walk, okay? The limitation of the movement is will discovered by the physical examination, all right? There are several patients come from the, to see me and, don't know about you have like the limitation, right? After after the take the physical examination, you will acknowledge that you have like the stiffness and limitation already, okay? You hear me? Yep, all right. Okay, So another thing is like the radiology or X-ray. Is just like to confirm the diagnosis. All right. For the X-ray, we will do the X-ray of the both hip. All right, to see about the condition of the hip joint. Right. We have two purposes to do the X-ray. All right. This is like to search or confirm about the abnormal anatomy or like the condition of the hip joint. The second one of the second purpose is like to find out about the sign of the coxatosis or degeneration of the hip joint, right? This is composed of three things. Firstly, it's like the reduction or like the loss of the joint space or narrowing of the joint space, right? The compression of the portion of the bone immediately under the cartilage that I will show you in next slides. The bony spur, right? That is like at the cartilage and bone junction. We call like osteophyte or bird beak sign, something like that. This is the X-ray of the both hip, all right? And you see this is like the bone spur, right? This is the bone spur, up and down portion of the cup or acetabulum part, all right? This is like the joint space narrowing. This is like the joint space narrowing. Okay, and the density of the bone, right? When you have like the abnormal loading to the joint, right? That means when you put the weight on, right? The bone is gonna be, has the reaction, right? It's gonna be, like the stimulate itself, like the bone density is more. It's like the packing of the bone. So this is the sign of the, we call like the bone density or sclerotic bone, right? This is the sign of that. When we saw like this X-ray, right? I know that the symptoms or, like the clinical manifestation of that in adverse thing. If the patient coming with the clinical like, stiffness or something like that, I will know as the same, like I will find out about this condition in the X-ray as well. Right? So I will try to communicate that if in the obvious condition or obvious clinical of the hip arthrosis, we don't need the investigation too much or complex or further investigation too much, such as MRI or something like that. Just plain X-ray, we can see it and we can, like the step or, like the give you about the stage of the arthrosis condition, okay? Go to the treatment, all right? Start with the non-drug, play the central role of that. No one need to go on for the operation or something if not necessary, right? We start from the, like the simple thing first. I mean, like the, like the non-drug treatment. Reduce the weight, right? This is the most important thing. When you got the weight loss, when your body weight is lower, the load is go to the joint lesser. So the effective, like the symptoms of the joint pain is gonna be lesser as well. This is the, straight, right? So exercise, like the aerobic exercise, I always told my patient about, like the breathing, walking about 30 minutes 3 times a week, right? Cycling, swimming, this is the best, like the exercise because of it not like the load to the joint, okay? But it's like the exercise of that, right? Yep, functional rehabilitation exercise to maintain the mobility and strengthening of the muscle, right? This is the another thing that it important, okay? Orthotic, I mean like the, walking with the running shoe that has like the thick insole, right? Or, like the walking aid, such as cane. I see somebody come with the cane today, right? This is like it can help to sharing the load to the joint as well, right? So articular economic tips, I mean like the avoid the activity such as, like the carry heavy load, walking in the rough ground or prolonged standing. I think all this thing is like the national, like the activity daily living that it hardly to, like the avoid that. So it quite impossible for the thing like, to adapt about this thing. Just a little bit room for that, but it cannot cope about the whole thing, the whole problem. The drug, okay, come to the drugs. We have like the analgesic drug or painkillers, all right? Paracetamol is like the simply and like the low efficiency of the painkillers, right? And safe medication. Okay, this is like the first line drug. If you can control by the paracetamol, this is the best thing, all right? Okay. If you cannot control by the paracetamol or not enough, right? We have to go on for another step. It's like the non-steroidal anti-inflammation drug. This is like the NSAID. But for the NSAID, it cannot like prescribe you in like everyone. Firstly, for the patient who allergic to it, it cannot. The second one is like the for the patient who has like the cardiovascular instability, renal insufficiency, you cannot take that, right? It's limitation, right? So in the group that you can take that, right? You should take like the short term, all right? I mean like the short course of the medication, and take only the just only the related to the symptoms. If you don't have symptoms, you don't need to take it.
Do you have a recommendation, a non-steroidal anti-inflammatory like an ibuprofen?
Mm-hmm.
Do you have any recommendation for once a day treatment? What dosage? And then how long do you think it's reasonable to do that?
I will tell you like that, all right? We use as less as possible that to control about the symptoms. No one can say that, 2 times, 3 times, something like that, but use it as less as possible to control about the symptoms of you, and take when you have the problem, not take too long, right? Nobody can tell you that, take a week, 2 weeks, 3 weeks, but whenever you take it longer, that means it's more side effect. Right, so just only control the pain and inflammatory process only. All right, try to take short course of that. Yep, answer your question, right? Yep. Okay, so another thing is like the cortisone injection. I mean intra-articular injection for the hip arthrosis condition. I think that it quite like need like the technically and quite hard to do that. All right, in my practice, it's very rare to do that because of it take like the it's like the very little space to do that, all right, to go inside to make the needle go to the hip joint, and the hip joint has to pass the big muscle, right? So when we need to do the cortisone injection, we have to do under the fluoroscopy or like the ultrasound. Okay, yep, it's not like the similar like the knee injection. Okay, that I will talk later. Okay, for the surgery, right? Total hip replacement is like the preferred prosthesis in the osteoarthritis. Okay, yep. We will change to the cup, I mean acetabulum part, and this is we cut the head and put the stem down. This is like the artificial joint. I will talk to you later, right? So by conclusion, for the stage of the hip arthrosis, we divide that in the 4 stages. Okay. Firstly, this is like the earliest stage. This is like wear and tear of the hip joint and maybe cause of the bone spur, but typical no pain. This is like the mild or starting grade. The second stage is like when the joint cartilage start to break down. I mean, it's like the quality of the cartilage is not good. There's like a breaking, something like that inside. It can create about the like the stiffness or pain in occasional, right? I mean the joint line is still okay. The third stage is like when erosion of the cartilage and narrowing of the joint space. You will see like the narrowing of the joint space in this stage. Okay, make everyday movement like walking or squatting painful and difficult. Right. The 4th stage is like the most advanced stage. Okay, loss of cartilage, joint lubricant loss. Okay, causes like the bone rubbing on bone. Right. The cartilage is like the surface between the joint, and if it wear and tear, it's gonna be like the bone crunching on bone. All right, you will feel like pain all the time when you move. All right, this is like the result of the chronic pain, stiffness, and loss of mobility. Yep. This is like the first stage. You have like the bone spur a bit, but joint line is still okay. The second stage is like the joint line is like narrowing, but you see like the bone spur and sclerotic bone, I mean densing bone, all right? You start to see that. The third grade is like the narrowing of the joint space, bone spur, sclerotic, and like there's like the bone spur more. And finally, this is like the last stage of that, right? Everything is like the detrimental things. So this picture is like the in the group of the anatomy of the joint, hip joint, that I told you. Some people have had like the normal bone structure, normal anatomy, right? When you have like the normal anatomy, right, and the grinding or movement of the joint is still okay, all right? This is like in the group of the normal or primary arthrosis if it happen. The second one, this is like the abnormal of the anatomy of the bone. You will see like two types of that. It's like pincer. Pincer is like the gun, right? Like the pincer there. The bone coming down to here. And when you move, there's like the impingement around here. This is like the originate cause to like the create about the arthrosis in the future as well. It's wrong of the mechanic. It is wrong of the anatomy. The third, another thing is like the cam. When you have like the bump, right, at the femoral head, it's similar like you put something big to the like the small part of the body, right? It's gonna be create like the impinge as well, and it start to degeneration. Two types of that. This is like the secondary or secondary coxatosis. All right. Yep. Yep. This is like the X-ray. Some patient has like the bump here, and that we know that in the long future is gonna be make like the arthrosis condition or coxatosis condition because of there's like start with the impingement, right? This is the pincer, right? Yep, it's gonna be have the pain when you have like the wrong movement, all right? It's gonna be create about the impingement as well. This is the drawing picture of the joint. Okay, joint surface is like the smooth and clear, but when you turn like the arthrosis condition, the joint is not smooth anymore, right? And it's create about bone rubbing on bone. Okay, this is like the concept. For the total joint replacement, all right, this is like the arthrosis condition or degeneration of the hip joint, all right. The thing that we will do is like we will ream the acetabulum and put the cup, I mean metal cup in, okay, to create like the acetabulum part, okay, to the good condition. And for the femur, for the neck of the femur, head of femur, we will cut it and put the long stem inside there. There's like the two technique, all right, cemented and cementless. Okay, that is proper in each patient. We have to discuss. I mean, like the if need to go on for the operation, right? This is the cup. I mean, it's like the joint surfacing. Joint surfacing. Normally, right now we have like the two popular things. It's like the polyethylene on the ceramic here and polyethylene on the metal, right? For the detail of that, you have to discuss about the risk and benefit of the like the each method later, right? We go on to the knee joint, right? This is like the gonatosis condition. Gonatosis is like the terminology of the knee arthrosis condition, knee osteoarthritis, okay? It's divided that as the same to the hip joint, primary and secondary. The primary cause, is not exactly condition or like the not confirmed condition. Which thing is like the cause of that? Some people like believe in the hereditary, right, gene or metabolic condition, such as the patient who has like the metabolic disease, diabetes, hypertension, some school or some theory is like called like it's like related a bit, okay, but not exactly. The second one is like the secondary knee osteoarthritis. Okay, yep. This is easier diagnosis and clear origin of the cause of that. All right. Firstly, it has come from the sport accident or physical trauma to the knee. High intensity physical examination, long period of inactivity, like long hour of the desk job, I mean, it's like not too much exercise. It can happen as well. You see, like, if you exercise too much, it's gonna be cause of the arthrosis as well. If you not exercise too much, that's gonna be cause of the arthrosis as well. So you have to choose like the optimum, all right, activities. It's very hard. Okay, arthritis of the knee symptoms, all right, it's like the knee pain. For sure you have knee pain, all right, when you climbing stair or when you walk in uneven terrain. Increased discomfort, I mean, it's like when you're carrying something heavy and you feel like if you're loading to the knee and you feel discomfort at the knee, you have to awareness for that, all right. Episodic, I mean, it's like the pain is will come and go on and off, not persisting. It's related to the activity that you have done as well. Pain behind the kneecap, such as when you're sitting for a long time. I have several patients who coming with the knee pain and swelling, right? They come to visit their relative in Pattaya, sitting about, in the car about 5 hours to here. About a couple days later, has like the knee swelling and pain. When you x-ray, you see like the arthrosis condition as well, and you have to realize that this is a cause of, the awareness sign of the arthrosis condition as well. Increased sensitivity, I mean, it's like you will feel like when you have like the cold weather or raining or something like that, you will feel like knee pain. All right. Crunching noise. Some patient coming with the like the grabbing sound, crepitus sound, right? That is like the bone crunching on bone. This is the sign of the arthrosis. The diagnosis is similar like the hip as well. History, this is like the most important thing. Physical examination, X-ray. Occasionally, like the MRI, maybe need that for investigation. I will try to communicate you that for the arthrosis condition, if it obviously that I told you, no need to do the MRI, right? Some patient coming to see me and request MRI, but when I take the physical examination, no, it's not, all right, because of it. Why you have to spend the money to do that?
Is the relevance of the weather, wet conditions, or cold weather to having pain in the knee?
It's like the like the proprioception. The proprioception is like the nerve inside the knee joint. That is like represent like the tension, like the loading, even though the temperature as well, right? If you have something that change, right? When you have like the degeneration of the knee, that means the nerve around there is like gonna be damaged as well. So it's hypersensitivity for this condition, right? Yeah, that's why. So for the MRI, I think that in my opinion, all right, it like they're hardly to do that if the condition of the knee is obviously, all right. So it has the useful in the clinical that is not clear, or like the early sign, or like the spot injury or something like that, all right. But obviously clinical of arthrosis, the X-ray, it should be enough for that. Okay, so we go on for the treatment. All of this thing, I think that my colleague Dr. Natchai will tell you about the like the lifestyle change, or like the weight loss or exercise that he will tell you. He will tell and talk to you later. All right, but this is like the start as the hip. All right, decrease the load, decrease the weight. This is like the most important thing. Exercise to build up about the muscle strengthening. We cannot train about the bone that degenerate already, right? But we can train the muscle around there, right? If the muscle strengthening more, strong more, that means it can sharing the load to the destruction joint, and the pain should be lesser, right? But it not can cope everything, every problem for that, all right? Just limitation. This is like in the part of the rehabilitation as well, right? Painkillers, like the medication, as same as the hip arthrosis, start with the analgesic drug, then non-steroidal inflammatory drug. This is like the second step. Another thing that I will additional, and I didn't put it in there, is like the cortisone injection. Cortisone injection in the knee joint is easier and technical, lesser than the hip, because of the bone at the knee is like the superficial bone and skinny, all right? We can find the anatomy that we can put the needle in, all right, without any existing, it's like the radiologist, X-ray, or like the ultrasound, okay? We can find, because of, it's like the skinny area, right? It can put the needle easy to go inside, right, and put the cortisone. I think that cortisone injection in the knee joint or knee arthrosis is quite efficiency for the treatment as well, before you go on for the next step. This is like the operation. For the surgery, total knee replacement, this is like the, like the last option that we will do. Always told my patient about, if you didn't get improved by the medication, physiotherapies, adjust your activity, daily living, right? That means, we have to talk about the operation, but let it like the last option that we will do it, okay? This is like a picture of the normal knee, right? When you have like the degeneration, the cartilage is wear and tear, right? And the meniscus and everything is gonna be wear and tear as well. So this is like the side of the arthrosis condition. It is answer about the like the weather, or like the why temperature is like the effect to that. In the meniscus, when you have like the nerve, okay, and the nerve is like the function of the proprioception, represent about the load, like the position, temperature. This is like the thing that is cause of that. This is the X-ray of the arthrosis condition. You will see like the narrowing of the joint space. Yep. Yeah, like the grade. Okay, start from mild to severe. Right. This is no doubt for the. If you see the X-ray like this, not wasting time to like the injection or like the medication. If you need to cope with the problem, total knee replacement. This is like the answer. I have the patient who come with the final grade of the arthrosis, and he still asks for the injection, for the cortisone injection. For sure, it can help for a while because of the chemical inflammation is caused by the cortisone injection, but the mechanic is not caused by the cortisone injection. We have to correct the mechanic. This is like the primary cause of the pain by the operation. Okay. Arthroscopy, in my opinion, all right, there's like the small room for the arthrosis condition, because of whenever you have like the long mechanic or long axis of the knee already. For the arthroscopy, we can collect about the soft tissue condition. We cannot cope about the mechanic things. So it can help you for a while for like the clean up the joint and cope something that we can collect it by the arthroscopy. But in overall alignment or something, we cannot cope with that. This is like the picture of the knee implant. Okay, you see it clear in there. We will cut the distal part of the femur and proximal part of the tibia, right? And put the like the prosthesis in. Between the prosthesis and bone, we grouting by the bone cement, right, in both sides. And in between that, we have like the polyethylene or plastic, all right, to interposition between the implant. Okay, this is like the concept. And this is X-ray for the like the after the operation. Okay, you see like this. So this is like the table that I think that you just take with you, all right? I mean, it's like the state yourself about the stage of the arthrosis condition, right? First stage is like the minor loss of the cartilage, my occasional discomfort when the joint heavy load stress, right? The second one is like the mild to moderate painful, follow intense activity or occasional stiffness, right? The third one is like the joint stiffness after prolonged resting, cartilage thinning, marked osteophyte. The fourth one, the final one, is like the dramatically reduced joint space, bone end deformity, severe cartilage loss, all right? Joint stiffness and movement loss, this is like the final stage of that. So this is like the stage of the arthrosis, all right? You can grading yourself about, like where are you right now, okay? Yep, thank you.
All right, I have a question. Did anybody not learn something from that talk? Right, that was incredibly educational. Thank you so much. It was so comprehensive. And again, another thank you to Daryl for maybe our doctor here. Another round of applause for Daryl. And we do have a doctor in the house who maybe not, you didn't learn anything, but it was fantastic. It couldn't have been any better, realistically. Now, do you want to take questions now? Or we'll have the second speaker and you can take questions together, right? So please welcome Dr. Natchai, and he's going to talk about rehabilitation therapies. Big round of applause.
Thank you so much. Okay. Thank you, Dr. Nammon, about information, a lot of information. But my session is more easy and more comfortable. Not too much, many information. I have to start with my questions. Okay, if you have a degenerative hip or joint, what is your aim of to go to the doctor to see what I can help? What is your aim?
Improve life quality.
Good. You not need a new joint to be the Iron Man. Okay. So I think nobody want to be have a new joint, but he need his quality of life. He need his ability to walk. He want to get rid of the pain. So I think the pain for the operation for the hip degeneration is like this. Have everybody agree with me, right? Okay. So next slide.
Okay, so this is that's the
Okay.
pointer, and that's forward, and that's back.
And this is forward, right? Thank you. Okay. Okay. So, in my experience, I just have many patients who had the operation, and I think they have like an aim. What is his topic that he concerned? And the first one, I think this is a pain, right? Everybody is concerned about pain. Oh, I have to have pain after operation or not? And after operation, I can walk like as same as before or not? Now I have to, how long I have to stay on the bed, all right? And the muscles, will be bigger or it can be stronger? How long I have to stay in the hospital, right? I can turn to be sport or normal daily activities or not. Okay. In the side of the doctor, we have also we concern in the side of the patients, but we have concern more about infection, pain also, and the other complication that can be happen after the patient did the operation. The most important is the respiratory problems. Many patients stay on the bed too long, and he developed the infection in the lungs or the lung collapse, or infection in the urinary tracts is quite common if the patient have to stay in the bed too long. We don't want to be happen. Range of motion of the joint is important. After operation, if you oh, I'm so scared for the pain. The doctor cannot control their pain, so he limit the motion. And in the future, that joint, the operation joint will become stiff, and it affect the patient in the long time. For walking pattern, he have to limp walking like that. So we don't want to be like this. Okay, the different thrombosis, the gait pattern, and daily activities. Now this is important after the operation. We want the patient to be the normal life and normal daily activity or better. Because of before they limit by pain, by the muscle weakness, but after operation, they can have a better life. Yes. Okay, so I want you to imagine what is after the operation, what is the timeline of after operation. Okay, so many patients ask me, oh, when he can start to walk. Okay, after operation, I think just first day or second day after operation, we start to walk. Ask the patient to walk with the gait aid, with the walker or with the crutches, depend on the functions of the patients. The range of motion we start at the first and second day. Sure, we have to control the pain of the patients. Mostly of the cases, pain from the wound, pain from the operation, so we can treat control pain by medication and also physiotherapy technique. We have a new technology for the rehabilitation and equipment to control the pain, that the patient not need too much medicine for the control the pain. I will explain you more. Okay, and we need the walk. Okay, the pain. We talk about the pain. Okay, how long you think that? How long the pain is last long after operation? The operation is quite big, right? Okay, so but mostly of the case, the pain is not over 2 weeks. Yes, from inflammations. But in some case, the pain is over 2 weeks. So that means have something problems, like they have a nerve complication, have infection, and very common condition that the patient who have a very last long pain is from the muscles. The muscle can produce the pain, and like a muscle cramp, and they're scared for the pain, and non-move, the muscle become cramped and tight, and the pain is last long, over months or years. Yes. Okay, and that this is a common complication like a wound, swelling. The foot at the operation site can be swelling for about 1 week. And that I ask the patient to raise the legs up about 1 week for decrease the swelling, and the wound healing should be on not over 2 weeks. For the hip replacement, we're more concerned about muscle exercise and hip dislocations. So this hip is not like a natural, right? It's artificial. So in the past, we worry about the hip dislocation. Hip joint is like a ball and socket, right? Okay, so you need to the soft tissue to protect the hip dislocation. The important muscle is the gluteus muscle, the gluteus medius and gluteus maximus, right? To protect. The wound is here, so you need to strengthen your side muscles and the back muscle for decrease the chance for have a dislocation. And also we have some position to take a higher risk for hip dislocation, like bending the hip over 90 degrees, twist inside, internal rotation. So the patient after the operation has to avoid to sit in the low chair, not sit across legs like this. Yes, and waiting for the muscle strength is better. and they enjoy the life. Okay. So the timeline of the knee replacement is mainly is almost same as the hip operation, but we have a bit concern about a little bit different between the hip and the knee. Okay, so for the hip, the muscles most concern is the hip, right? The gluteus muscles, but the knee is different. It's quadriceps muscles, right? The quadriceps muscle, you know, everybody know? Yes, okay. Quadriceps have 4 head, right? Have 4 head, that's called quadriceps. Okay, but the most important thing, most important quadriceps is the quadriceps muscle is a shortened one nearby the knee. Is a support for the joint. The action of this muscle is around 30 degree bending. Okay, so I will talk more about this muscle exercise that is have a benefit for you. If you have a strong muscles, you can delay the degeneration process of the knee joint. Okay, who know how to exercise the quadriceps muscles? Sorry? Leg extension. Very nice. We have many things to do the leg stretching, right? In the case who has not quite have a strong muscles, you can start to strengthen by in the sitting position, right? You just straight your legs like this, yes, and hold for 10 seconds, right? Okay, that you contract these muscles, okay, and you change to another side, okay? Don't do it together, you maybe have a back pain. Yes. Also, if you need the muscle stronger, you can put some like a sandbag at the ankles to more resistance. Okay, easier. Who know about squat? Yes, squat is a good exercise, right? Okay, squat is quite easy. You just separate your legs between the foot at the shoulder level like that. Okay, and then you drop your butt behind. Okay, that I told you 30 degrees, and this is action for strength for this muscle, right? You just drop down and straight. Drop down and straight. Yes. Okay. Repeat about 10 times per set. Relax for 1 minute, and you repeat for 2 more sessions, right? If in the case who has not good balance, you can hold something like a chair for prevent the falling, okay? Not move the leg, the knee forward, okay? So that this is a very good exercise for the quadriceps and the hip muscles, okay? And the more important thing is range of motions. The knee operation is like you think the bending is difficult, right? Because of maybe pain, right? But in my opinion, the bending is not too difficult, but fully extensions is more difficult after the operation. The knee is quite straight. If you not get the fully straight at the first week or after second week, it's difficult to collect the full extension. The patient may be a little bit shortened on the one knee, one side, and walk like a limping. So this is important. This is I quite concerned after operation patient to have a full straight of the knee joint, and then the bending is can start every day step by step until can reach to 90 degrees in the first week. Okay, what is rehab do? Right. Okay, so then I talk with you about the pain, right? We have we know a lot about the NSAID, the medications, the painkillers, but every medication have side effect, and so we have another options for the rehab equipment. The rehab equipment use light, sound, like heat, to improve inflammation, decrease inflammation. If no inflammation, no pain, right? Okay, this is the ultrasound machine. This is a high power laser. You know, have anybody used it? Thank you. You used to, you know. The high power laser is a new technology for release inflammation. We use the laser to decrease inflammation, increase the blood supply. We can use at the first day after the operation. Yes. In some case of like an injury, fracture ribs, also is very nice. And the patient is relieve the pain 24 hours. If too early, it's more effective. Yes, this is one of the equipment that I think is quite nice. Okay, ultrasound uses sound to relax the muscles. In the case of the patient who have a prolonged pain, sometimes that is not from the joint or inflammation, it's from the muscles. And so if we can treat the muscles, the pain can be better. Yeah. This is a short wave. Short wave is like produce a radio wave inside the joint. It's quite deep. It can become through the joint, hip joint or knee joint. Okay. And also we have some machine to move the joint slowly. We call continuous passive motion machine. And the first day, 2 days, the patient is quite painful and he's scared for move. We have options for move the patient to less pain.
How many people smile when they use that machine?
Oh, everybody.
They smile like this?
Smile like this, but not video. Believe me, no pain. Yeah. But we graduate, improve a little bit, but range the ankle is a step by step. We limit by your pain. Right? Okay, so the muscle strengthening exercise that I informed you before is quite important. The rehabilitation, in my opinion, right now we concern the patient only after the operation, right? After operation, we start the rehab, but it's better if we concern in the rehab before the operation. In the case of the result of the operation, it depends on the patient previous conditions. If a patient is a sportsman, have a good muscle strength, and also have a good muscle endurance, I think after operation he have a good result. Right? Good. And we have to concern about proprioceptive. Okay, some case of operation is from the accident, right? Walk and fell down is quite common, and hip operation. The joint that Dr. Nammon said that the joint also have a nerve inside. This nerve is told us about what is the position. That I stand on one leg and they don't fall down, right? Because of the brain have told by the nerve that I have to stay in this position, right? After the operation, the surface of the joint is lost, the nerve is lost, the patient have some problem with balance, So we have to train him more about balance for prevent the accident, or can turn to be sport and walk, be normal, right? Have many techniques. I don't want to talk here. Okay, and walking training. Walking training, some case just operation and okay, walk, right? Many patients walk limping, not straight. So it's not look nice, right? And also if you have a limping and you walk not straight, in the future you maybe have a back pain or the pain in the other side, or promote the more degenerative in the other side. So walking pattern is important in the future. Okay, so that's it. Thank you very much.
Well, one thing among other things I'm going to take away from that one is that prehab could be as important as rehab, right? Doing it before you have the operation, right? I'm going to copyright that expression, prehab, okay? So, yes, we have questions and answers for either of the doctors. We want to get a microphone to you so you can actually be recorded on the video for posterity. We have an annual prize for the stupidest question of the year. So, you're in a competition, okay? So just here, you're just here. So I'll get both the doctors out here, and so because it could come for either of you. Thank you so much. A big round of applause for both doctors. Fantastic job. Really educational. Thank you. Thank you. It's not actually quite dead. Can we get any more volume there? Give it a try.
Hello. Can everybody hear me?
We can.
My question is, what you didn't touch on is, depending on the severity of the joint, what about MSC stem cells first? Treatment.
Stem cell? It's on.
All right. Okay. For the stem cell, right, it's similar like to decrease the inflammation process of the joint of the pathology inside. We reference in my talk, right, mechanical pain and chemical pain. All right. I think that stem cell is like the cope about the problem of the inflammatory. Right. So it's limited use. I mean, like if your joint is destruction until it's wrong mechanic already, I think that the stem cell is like the limitation of effectiveness.
Yes,
right. But there's like
on
the role for that. But just like you have to see about the stage of that. If it's like still like the joint line is only inflammation, right? Yes. So stem cell is like the option as well to calm down the inflammatory process. Yep.
Depending on the severity.
Yep. Right.
Thank you.
Well, how helpful are getting massages here? There's so many shops all over town. I mean, if, for example, if you just feel normal inflammation and trouble walking up the steps a little bit, holding on when you have to stand up, what do you think about massages therapy prior to having major problems?
Okay. Right. So that is you have some pain, right? The patient have some stiffness after in the prolonged position, right? So this is a sign of mild inflammation. Yes, if you have some inflammation aggravated by something, and you stay in the same position and you start to move it, and become stiff and painful. This is a mild inflammation. For the massage, usually I recommend the massage for the muscles. In many cases, he's complain about pain at the knee joint, especially knee joint or the hip joint. The problem is maybe not from exactly joint. It's from the muscles around the joint and refer the pain to the joint. Okay. The first, I ask you to if you like to massage or relax the muscle, I recommend in the quadriceps muscles and tensor fascia lata at the side. You can put like a warm pack, and do gentle massage by yourself, right? And you see your knee pain is better or not, and you can increase put the hot pack at the knee joint for improve the blood supply, and inflammation of the knee joint can be better. Yes, you can try if you ask for try to conservative. About 4 times it can be better. If not better, you have to find out what is the cause of this pain. Maybe not the muscle, maybe from the joint degenerations, like that.
So a traumatized muscle can actually pull the joint out of normal ideal alignment, the muscle trauma.
In my experience, many cases is a success for treat the muscles. Like a patient who come with the ankle pain, at the knee pain, sometimes it's a muscle problem, but it's not every cases, right? Yeah.
Thank you. You want to say something?
Yeah, right.
Wait.
Okay, so for the massage, right? I have several cases for coming and ask me that I can go to Thai massage, I can to massage or not. I always told my patient about the massage is like the room for the, like make you relax, okay? The muscle is like the relax and stretch, okay? But whenever you push like the heart to the muscle, right? That means you put the inflammatory process to the muscle as well, right? So that means you will feel more comfortable in about 1 or 2 days. And after that, the process of the inflammation is go on. So you can coming back for the vicious cycle again. So the thing that I recommend is like the stretching exercise to stretch the muscle, right? And relax the muscle by the exercise, that by physiotherapies. This is the thing that is useful and helpful, right? Yep.
Hello? Doesn't work.
Speak up.
Yeah, what about the shoulders? Because that's a rotator cuff, because this is more prone to dislocation than the hip. And,
Question.
Frequently you get more shoulder dislocation every other
Shoulders. He's got some shoulder issues every couple of months. He gets something to do with his shoulders.
Shoulder dislocation, right? You mean shoulder dislocation? You ever had it before, right? Yeah, right. So, like the shoulder dislocation, the joint of the shoulder is not like the ball and socket like the hip joint. That is more stable, right? The stability of the shoulder is like maintained by the tendon, right? We call rotator cuff, right? It's like the 4 tendons to maintain it, right? It's very easy for the dislocation if you have 1, 2nd, 3rd times of the dislocation. It's more easy and like the more frequently, right? The thing that you have to do is like the strengthening exercise as well, right? By the physiotherapies or like the weight training or something like that, right? But if you did it for regularly and quite maximum thing that you will do it, and it's still dislocation. So that means there's like something inside that there's the problem, right? So has to do the MRI to find out about the problem and try to correct it.
Thank you. Really, I have 2 things. But A is how much would this knee operation cost? And what you've never mentioned, injections, cortisone injections or anything into knees. Why haven't you mentioned that?
He did actually mention cortisone injections. Yes, it's probably the accent thing, but he did mention cortisone as an option.
Oh. So how much will the operation cost then, please?
For which operation? Geez is the operative word here. She has some answers, I think.
The operation costs for total hip and total knee, right? Yes, the first one is package for total hip arthroplasty replacement operation is 3,000 359,000.
355,000.
359,000.
Yeah.
Yes. 359,000. This is including 5 times rehabilitation. They are combined in the same package. This is the special price until the end of June. And the second one is total knee arthroplasty operation is 299,000. Include 5 times rehabilitation as well.
By the way, while I think of it, pay very careful attention to what I'm going to say, okay? Who here has ever heard of Yoko Yoko, besides the people I've already introduced to it? Go to the pharmacy and buy Yoko Yoko. It's about 220 baht. It's an anti-inflammatory thing. It's very herbal. If you've got localized pain, like your back, knee or muscle, put some Yoko Yoko on it. You'll be amazed. It might save you taking more oral painkillers. You'll always remember who introduced you to Yoko Yoko because it is so useful. Somebody's giving me the thumbs up there. Yoko Yoko. Everybody, I don't travel without Yoko Yoko, okay? It's also got a great applicator which allows you to get it onto your back and stuff. It's just like John Lennon and Yoko Ono, but it's 2 words, Yoko Yoko, okay? So, yeah. It's not ibuprofen cream. It's like, I don't even know how to describe it. It's natural substance, and it's like, how would you describe it? You're the Dr. David. Yeah, it's a herbal equivalent of ibuprofen that you put on your skin, and it really is fantastic. And people have come to me and said, I put it on my gout. It's really helped me with my gout and stuff. So any localized pain like that, really, try it, okay? Definitely. Yes. Yeah, definitely. It's like 220 baht. It's really gold. Sorry, we've got a lot of questions. So he's working his way across the room. One more up the back.
Yes, I've been dealing with grade 3 hip and knee. I've been using hyaluronic acid, which you didn't mention, for the hip and knee. Physical therapy, actually having degenerative disc disease on the hip and knee. I was like 5 millimeters shorter on one side, and for years I was overcompensating for that. I got some help, physical therapy and injections, and now I'm more even. So yeah, you didn't mention HA. Could you extend that?
Sorry, hyaluronic acid.
Yeah, something like that.
Hyaluronic acid, right? Yep. So for the hyaluronic acid, right? Yep. So this is like the joint lubrication and decrease some inflammation process as well. I still, like the, tell you about the concept of that. It's like, like the, it's like a joint lubrication. Okay. It's similar like you put the engine oil to lubricate the engine, right? Yep. It's less friction and less inflammatory process. But going back to the same, if your mechanic is wrong, nothing to help with the, to correct about the mechanical things. It's just only to correct about the primitive cause. That means it's like correct the mechanical problem. As the same, there's some stage of the arthrosis that can help, such as you see the x-ray, you have like the joint line, okay? This is like the option of the treatment for cortisone injection, hyaluronic acid. But if it like the, like the bone crushing on bone, it wastes the money, yep.
Well said. So I wanted to share something that might be useful to someone else. When I was 24, which is a long time ago, I had a knee problem, I had pain, I had excess temperature and inflammation. I was told that the cartilage had worn away and it was bone on bone that was causing a problem. The doctor gave me anti-inflammatory and ended up giving me a walking stick and said there was nothing more he could do. I decided to get a second opinion and went to a health food shop, explained my situation. They said, the reason why your cartilage is worn away is because you're lacking in selenium. I took selenium tablets 1 a day for a week. She said that this would promote the regrowth of the cartilage. It did. And at the end of the week, I was able to get rid of the walking stick. I had no more pain, no inflammation, no excess heat, was able to go back to work. And I went back to the doctor and I said, told him what he could do with his walking stick. And I said, how is it that a teenager in a health food store knows what the problem is, what the solution is, and it's affordable, like £3 for selenium, and you don't? And the answer was that people generally, doctors don't get that kind of teaching at medical school. They get to know about medical procedures and drugs, but nutrients are not something that they know about. So if your problem with your knee or your hip or any other is that you're lacking in selenium, I would encourage you to try that. There is a natural way that you can do this, which is either Brazil nuts or seafood that has selenium in it as well. Don't overdo it, because you can, but it might be worth trying that if you have an issue, and maybe you'll have the same solution as me, which is that 39 years later, my knee is still fine and I still don't need a walking stick.
I would like to chime in on that. My naturopath put me onto selenium a long time ago for prostate for guys. It's very deficient in the soils because they farm it out and they don't replace it. Okay, so every guy should be on selenium and zinc. The combination apparently is more powerful together. And I went to Australia once for a week and I thought I won't take my selenium drops with me, hey, it's only a week. After 4 days, my prostate started to ache. Put a friend onto selenium, he said, I can go to the toilet much more easily like the next day. You can get it through Lasada, selenium. You can take too much of it, you get selenosis. So, you can get it from Brazil nuts. It's probably cheaper to get the selenium tablets, actually. And you won't overdose on it. Brazil nuts have a lot of it in, actually.
It was explained to me in exactly the same way as it explained to you, that the soils don't have natural selenium in them, and that you, especially in New Zealand, which is where I lived for 11 years, multiple people said to me, you must make sure that you supplement for
especially
selenium.
for me.
It's not in the ground. It was transformative to me. As I said, I was off work on and off for 3 months at age 24, and I was told there's nothing more you can do. I was going to be a cripple for the rest of my life, and all I needed was selenium tablets.
Yeah. Every guy should be on selenium, absolutely. Women, I'm not so sure about, but guys.
Thank you.
Yeah, good on you.
Yeah, I have a question for both of you, prior to and after for physical therapy. Do you advocate and offer electromagnetic pulse therapy for your patients?
Oh, rehabilitation.
Yes, you mean the TMS, right? Magnetic stimulation. Right, it's like a magnetic wave, right? In my opinion, the magnetic treatment is no role for a degenerative joint. Yeah, right.
Just a quick question. It was mentioned briefly earlier. Back in the UK, I had an accident, broke my kneecap, and I was laid up for 6-8 weeks or whatever it was in full plaster. And I had a lot of problems with my kneecap and my knee joint hurting. That completely stopped when I came to Thailand, and that was because of the warmer weather. Would you believe it? That, what else did I need? Just warmer weather.
And less stress.
Well, yeah, maybe.
Yeah. I think just beside you there's a question.
One here before.
Oh, okay.
I heard for the package for the total hip, the financial package for the total hip, I just want to make sure I heard this right. You said 359,000 bahts, which is just under 10,000 US dollars. Did I hear this right? For the total hip? Okay. Quick question. The other question. Do you consider plasma-rich, platelet-rich plasma injections as being therapeutic, symptomatic, or a waste of money? The injection of platelet-rich plasma injections.
Yeah, right. It's similar like the stem cell cortisone injection. All right. Fresh plasma FFP is like the you sprint the blood. All right, your blood. All right, and correct about the anti-inflammatory process. Right, go inside and push it back. All right. Hopefully, this substance can calm down the inflammation process. it can use in some stage of the arthritis. Okay, it cannot use in all over the stage of that, right? Just mild to moderate. It's like the to moderate. I think that is like the option, but mild. Okay, you can try. Okay, but final stage, mechanical problem already. I think that is no rule for that as well, right? Just calm down the inflammation process. But if you need to try, you can try. Okay.
Hello, everyone. My question is about the relationship between, what is the relationship between the hips and the knees and the back, for that matter, the spine? And with me being, I've got knocked knees or kissed knees, right? And does that exacerbate the kind of pains and kind of joint pains that you were talking about?
Yeah, right. For the knock knee, all right, it's like the hyperextension of the knee, right? So that means the abnormal load is created to the knee as well, right? It's not like the, in the normal alignment. So that's why, you can have chance of, like the earlier turn to the arthrosis condition because of the abnormal loading to the knee joint compared with, normal knee joint, right? If you ask about the association between the back, hip, and knee, right? It's similar. You imagine about your body is like the one axis, right? Yep. If there is some axis of that's composed to make you straight and balanced, it's go wrong. That means it's like the consequentially, right? It can turn like your gait is abnormal, right? Load to some joint. I mean it's like hip joint or knee joint, and when you have load more to the joint, plus with you are abnormal of the anatomy as well. So it can turn to the earlier sign or earlier symptoms of the degeneration. Yeah.
Yeah, I was born with knock knees too. Oh yes, please.
Thank you so much. Okay, so that Dr. Nammon talk is about the legs and the back is connect together. Okay, it's like a chain. If you have some limitations or abnormal movement in one joint, it's affect. Even it's maybe start at the ankles, it's affect to the back. That's okay. So the tight muscle, the abnormal motion, the abnormal alignment of the joint is also affect together. Yeah, confirm.
Okay, I've worked a job where I was pretty much a high risk for having knee and hip problems. In fact, many of the people I work with did have knee replacements, did have hip replacements. Somehow I managed to avoid that. And I've had knee and hip pain off and on for a long time. But since I've gotten to Thailand, I've been walking pretty much every day, doing some leg extensions, that kind of thing. And my knees and hips seem to be pretty good at the moment. I'm just wondering though, is it kind of, if it's not broke, don't try to fix it, or should I be a little more proactive and look into treatments and whatever to see if I need to do more rehab wise?
Prehab, right? So you
Yes, that is back to my questions now. Okay, if you have a bad joint, even if you have a bad X-ray or something is quite bad, but you didn't have any abnormal symptoms, you have no pain. You can walk. You can do like a normal daily activity. You can join sport. In my opinion, you can delay or prolong. You just support and delay the degeneration and your symptoms by you can exercise. Your muscle is very important. The exercise is not only the muscle strengthening exercise, the endurance exercise is also more important. If you have a good muscle strength, but the muscle is quite easy for fatigue. If you do some activity is too long, it's become fatigue, and the muscle have more strength in the joint. It promote the pressure in the joint. Also, the flexibilities of the joint of the muscle is also important. Yeah.
So do you have, like yoga, stretches, those sorts of things are useful, do you think? Yoga?
Yoga, yeah.
Yeah, what about Tai Chi? I hear more and more reports about how great Tai Chi is for all sorts of things.
Right. I will explain more about the exercise. The exercise in each exercise is different. If you practice some exercise, is not effect in another side. Okay. Yoga is good for stretching and improve the muscle flexibilities, and also you can exercise like an isometric exercise. It's contract, right? But over stretching maybe have injuries to the joint and the ligament. So I don't want to be over stretching, right? Like a knee joint, if you can bend not over 90 degrees, it's okay. But if over 90 degrees in the long time, is a lot of increase of the pressure in the joint and have more degeneration, right? If walking and tennis is not the same, right? So in my opinion, okay, and also Tai Chi. Tai Chi is like a slow motion movement, right? Okay, what is the aim of the Tai Chi? You know, who know?
Get the chi flowing through your body, balance up your body,
Yeah.
balance up yin and yang.
Yes. Okay, this is Chinese concept, right? Yeah. But for scientific, we train the proprioceptive. We train the balance, right? In the case of who practice the Tai Chi, decrease the fall risk significantly. Okay.
Hi. Hello. Thank you very much. They were both great talks. It's so hard to explain for everybody the such complicated things in such short talks, and I thought they were great talks. Thank you very much. I just wanted to ask, I know that with hips there's been a process of development in hip surgery and different approaches for hip surgery, and some, perhaps younger orthopedic surgeons like you would probably do a different way to some older ones. So it's sort of better to get the young ones because people are up and moving more quickly and stuff. Would you say anything about that, about different approaches to hip, whether it's a lateral one or anterolateral one at all? Dr. Nammon?
Okay, this is like the details of this operation, right? Yeah, we have like the anterior approach and posterior approach, right? In my practice, I almost always do the posterior approach, right? My professor told me that this is enough for the, like the hip approach, but there's like the anterior approach as well. In each part of that, in each method of that, there's like the, benefit and business benefit in each method, all right? For the posterior approach, well, firstly, try to do something that you familiarize, all right? Just that you go inside by the posterior approach and you think that you can keen with that and no problem with that, you do the posterior approach. Anterior approach, if you do that and that's never have the problem and you're familiar with that, that should be fine, you can do that. But for the benefit and disbenefit, in each approach, there's like the benefit and disbenefit as well, right? For the posterior approach, it's like there's chance of the posterior dislocation, right? The chance of posterior dislocation and destroy the big muscle for that. But if you can do the, like the special approach, right? Like the preservative of the big muscle or something like that, that should be okay, right? And like they're easier or something in my opinion, right? For the anterior approach, you have like to understand about the anatomy of the hip joint. You have like the capsule, right? Anterior capsule and posterior capsule, right? Which one do you think that is more stronger? Anterior, all right? It's like the most thick of that, all right? If you go to anterior approach, all right, and you have to destroy about the biggest, strongest capsule of the hip, you destroy it already. So that means, in my opinion, I don't need to disturb about the natural things of that. So that's why I prefer on the posterior approach. Yeah, that's thing, all right? But anterior approach is like the benefit of, like you go to the hip joint, you pass the muscle lesser than the posterior, right? Go to the hip joint, it less pain after the operation, right? And the chance of posterior dislocation is lesser because of you don't disturb about this thing. But anterior dislocation, you still have the problem, all right? Yep.
Happy with that answer, David? Good on you.
Thank you for your presentation. Excellent slides, very easy to understand. And Ren, thank you very much for sharing additional information about preventative ways, and the other gentleman that did so today. Thank you all for that. Question, another comment. Thank you to Bangkok Pattaya Hospital for putting together a package for us.
Here. Round of applause for Bangkok Pattaya Hospital. They've been
helpful.
fantastic to us. Thank you, G's.
Especially for us who pay out of our own pockets. For those that are self-insured, it's extremely valuable to know this is the package deal. But I have a question regarding the package, and it may be addressed to you or whatever, but is it possible to put down when we go into a hospital, we sign a paper which says, basically we give away all our rights. I get that, but can we put a caveat on there that says, this is the package price that I agreed to. If my treatment in this hospital is going to go above that price, I have to agree to it before it's done. Would the hospital allow that to be added into the notes for the contract saying, I agree with this package, but if it goes above this package, I have to agree to it. And if I don't do it.
So you're talking about them adding on costs that you hadn't agreed to. Do you want to comment on that, G's, or do you want to talk to him privately afterwards? I think maybe talk to him privately afterwards, but I'm interested on the report that you say, okay?
You're welcome.
Yeah, please do. Another question. We're going over time, of course. We really need to wrap up. One more question. I know you've been very patient, sir.
Yeah, regarding hip replacement, I know I read somewhere where there are many manufacturers of different devices and so on. I guess a quick question, how long does the hip replacement last? Does this prosthetic eventually wear out?
Yeah, right. Everything has like the shelf life, all right? The prosthesis of the hip, all right, normally we claim like about 10 to 15 years, right? But it depends on your condition, your activities. Depend on me, depend on you, right? Depend on me is like I can put the prosthesis in the right position and proper position, proper alignment or not. Depend on you is like depend on your activities, your exercise, your muscle strengthening, all right? Your activity, daily living or not, all right? The shelf life prosthesis is like about 10 to 15 years, but it's not everyone that's go on for the, revision, all right, in the future. But after about 10 years to 15 years, the chance or the statistic of the chance of the revision is higher, right? Yep, it's like from 12 years. There's chance of, chance of revision more and more and more, right? Because of the prosthesis has like the wear and tear as well, right? Yeah, this is like the answer of that, yeah.
Well, I don't think that could have gone any better than it did. Well, congratulations, guys. Fantastic one. Come together. We've got a small token of our appreciation. Dr. Nammon, Dr. Natchai, come together. We'd like to take a photo for Pattaya Mail. You want in the middle here? Okay, come here. I'll wedge in.